Using the hip hook for the very first time might be exquisitely painful. The reason this is because we're addressing a muscle that likely has never been touched or addressed in its entire life. It could be tight for decades and you wouldn't even know. When a muscle is holding tension for a very long time, not only is it tight, but it's angry, it's tired, it's exhausted, and oftentimes inflamed. So when you push on a muscle that is in that state, it's likely not going to be very happy. But happy muscles don't hurt. So if you are experiencing tension and tightness or pain in that muscle, it's likely that that muscle is not happy and needs to be addressed. Now, some people, when they use the hip hook for the very first time, they'll experience a release. They'll experience like lessening pain. Maybe it was really intense right away, but then like a minute later, it's a little bit better. That is common, even the first time you use the hip hook. However, many people don't experience that. And what they might experience is just like maybe some subtle changes in their body. Maybe the symptoms will move from one place to another. Maybe it was in the hip joint, and now it's more, you're feeling it in the glute, or it's flared up some sciatica or something like that. That can happen because your body's trying to rebalance itself. And I would just encourage you to stay consistent. Every other day, doing the hip hook over a period of time is really what's going to generate the most long-term effect. Typically it would take doing the hip hook maybe 3 to 4 times per week over the course of 2 to 3 weeks in order for you to start noticing improvement. Now, the tight hip flexor is only one piece of the puzzle. If there are other muscle imbalances, or there are other areas, malalignments, or other areas that are not addressed, this may not be the only thing that you need to do, but it's oftentimes a missing piece in your rehabilitation plan. So if you're already doing a bunch of other things and you're not getting better, you start using the hip hook, that could be the piece that, that really helps you get the full way. So I would encourage you to take it easy, be patient, give yourself time. It's important to understand that this muscle has likely been tight in your body for a very long time. It's not going to all of a sudden just release and relax with one session. It will take time to undo the pattern that your brain has created to help protect this area of your body. And with patience and perseverance, you will get to the point where that muscle is relaxed and your body can function more normally.